both. Thank you very much. Now it's time to introduce our today's speaker, my friend Dr. Vidyasagar M. Panchalji, sir. And just thank you very much to ZANDU team and Dr. Pawan Kumar Sharma ji for providing me an opportunity to introduce such a great personality of today's eminent speaker, Dr. Vidyasagar M. Panchalji. So Dr. Vidyasagar M. Panchal is a son of Sri Mallikarjun Panchal and Srimati Prema Panchalji, who was born on 29th May in the year 1993. And if I take introduce about his educational qualification, he completed his BMS in the year 2016 from Sri JG Cooperative Societies Ayurvedic Medical College and Hospital from Ghataprabha. It is in Belgaum district, Karnataka. And he also completed his PG, that is MD in Kayachikitsa from Ayurveda Mahavidyalaya Hubbali. And most important thing is that in MD Kayachikitsa, he secured 4th rank for the RGHS Bangalore, that is Rajiv Gandhi University of Health Sciences, Bangalore. And in final year MD examinations, and also he's secured a 2nd rank in the first year of his MD Kayachikitsa. And if I introduce about his professional summary, Dr. Vidyasagar as an MD in Kayachikitsa under the eminent guidance of our wonderful and great personality, Dr. Prashant AS, who is a principal of Ayurveda Mahavidyalaya Hubbali. And in last month, on October 2nd, we had a wonderful session as a speaker from Dr. Prashant sir for the liver disorders. And Dr. Vidyasagar Panchal is a student of the renowned legend of Ayurveda, Vaidya, that is Ananta Dharmadhikari, Pune, and learning critical aspects of Charaka Samhita and applications of basic principles of Ayurveda from him. And Dr. Vidyasagar served as a PG representative Ayurveda Mahavidyalaya Hubbali for the year 2019, and served and he is a founder of Sanatana Ayurveda. It is a unique study platform for Ayurveda scholars, and organized more than 20 webinars from this platform, that is Sanatana Ayurveda. And moreover, Dr. Vidyasagar is an academic director for the Prastuta Academy for Specialty Studies in Bangalore, Karnataka, and he's an organizing committee member of Jignasa. Not only that, so Dr. Vidyasagar is an organizing committee member of Tadvidya Sambhasha, that is National Level Intellectual Meet 1 and 2, and is a district coordinator for Vishwa Ayurveda Parishad for Bida district in Karnataka, and is an active member of Pragna Pravaha in Karnataka. Then Dr. Vidyasagar is a fellow of Academy of General Education from Manipal University, Manipal. And Dr. Vidyasagar M. Panchal has published many papers, like author of translation book, that is Rognikam Vimanam, that is written by Vaidya Abhijit Saraf from Nashik, and published by Chokamba Prakashana, that is from Varanasi. And he published 5 papers in international international peer-reviewed journals. Dr. Vidyasagar published many articles in national and regional languages. He delivered more than 20 lectures in national and international platforms as a guest speaker. And presently, Dr. Vidyasagar M. Panchal is working as an assistant professor in the Department of Kayachikitsa and Rajarajeshwari Ayurvedic Medical College, Humnabad, Bidar district, Karnataka. So this is a brief introduction regarding Dr. Vidyasagar Panchal. Now the session to hand over to you, Dr. Vidyasagar Panchal. All the very best, and thank you very much for being a speaker for us. Thanks.
We welcome you, Dr. Vidyasagar, and I am also state convener of Vishwa Ayurveda Parishad here in West Bengal. Hari Om. Hari Om.
Great to know, sir. Hari Om.
Welcome. Please continue.
Hari Om. Ragadi Rogan Satatana Shaktan Asheshak Kaya Prasratana Sheshan Outsukya Moharatitan Jagahana Yopurva Vidyaya Namaskar. Sri Gurubhyo Namaha. Hari Om. First of all, I bow my feet in the lotus feet of my Sadguru and my Ayurveda Guru Vaidya Ananta Dharmadhikari sir, and Vaidya Prashant S sir, and Vaidya Abhijit Saraf sir. All the eminent doctors of Ayurveda field from whom I learned something. And my heartful thanks to the Imami and ZANDU pharmaceutical company for calling me as a guest speaker. I'm not such a great personality to speak in front of such legends in such a big platform of ZANDU, but still I try my level best to put forward my views about the today's topic, that is acid peptic disorders and its and their scientific management in the field of Ayurveda. So everybody has known about the acid peptic disorders, and so many people have spoken in many national and international symposia. I'll not go in detail about the Nidana, Samprapti, and in detail about the definition or the Nirukti, such things. Today, I thought of putting the topic in a different way in front of you. I think very few people have presented in that manner. And what I have learned from my Guru Vaidyanatha Dharmadikari sir and his views, and what I am practicing since these days, and my clinical experiences. First, we'll go through the Shastra, because without Shastra, Shastra is of no use. And without Shastra, the medicines are also of no use, because everybody can be a physician. Okay. By knowing simply if a patient of acidity or the acid peptic disorders comes and we just prescribe Kamanada Rasa or Sutta Shekara Rasa, Avipatikara Churna, we just become the catalog physicians. We should not be in such a mood of simply in a hurry of prescribing something. Before that, it is very important to learn about the condition of the patient. So in this regard, I for around 20 to 30 minutes, I will speak about the disease as such and their role in today's era, and then the remaining time we'll discuss about the Chikitsa part. So first, if any patient comes to you of the acid peptic disorders. So today's world, it is a very common disorder because of the lifestyle. Today, whatever the person gets to eat, he eats that on the roadside or the street foods or everything. So these things are creating the problems. So as it is said in the Shastra, that is, Pathe sati gadarthasya kimoshada nishevane, Pathe asati gadarthasya kimoshada nishevane. That is, if a person follows Pathya, there is no need of medicines to him. And if a person don't follow Pathya, then also there is no need of giving medicines to him, because it's not going to cure. So in such manner, Pathya becomes very important. In that regard, Charaka explained Ashtavidhi Ahara Visheshayatanas in Charaka Samhita. They are Prakriti, Karana, Sanyoga, Rashi, Desha, Kala, Upayoga Samstha, and Upabhokta. If a person consumes food in these manner, okay, then there is no question of the acid peptic disorders or any other GI problems. So that is one the person should understand. So these are the Ashtavidhi Ahara Visheshayatanas. In that, in the Vimanasthan of Charaka, he says, Jirne Ashniyat. What is that? Jirne Ashniyat is the person should consume the food only after the previous food gets digested. That is Jirne Ashniyat. Ushnam Ashniyat. That is, we should consume the hot food only, the warm food only. We should not keep the food in the fridge and later on next day consume it. That is not the Shastra is explaining. Okay. So Jirne Ashniyat. Ushnam Ashniyat, we should consume the always the warm food, okay, and the instantly prepared food is very good for the health. And Snigdham Ashniyat, the Snigdha, there should be Snigdhata in our food, okay. So Snigdhata is what we should not consume the Ruksha, that is the Viparya Tantrayukti of that. So Ruksha Ahara, when the person consumes continuously, it is also becoming a Hetu. So Matravat Ashniyat, we should not consume continuously. Matravat. What is the matra? The Shastra has told that we have to consider. Ishta deshe, Ishta pradeshe, where to eat, how to eat, everything the Shastra is explained. Nati dhrutam, na ati vilambitam. We should not eat continuously, very fast. Na ati vilambitam, very slow. Keep sitting for a dinner for more than 1 hour. So that also is not good. Ajalpan, ahasan, tanmana bhunjita. So we should not speak more. We should not do hasya or the laughter during the food. And tanmana bhunjita, we should consume the food with wholeheartedly, with all the shraddha towards the food. So when the person is doing all these things, there is no question of any dosha vaiparitya or causation of any amlapitta or grahani or any other the acid peptic disorders. So coming to the Agni, it is very important in these conditions. Agni is very important, as there are 4 types of Agnis Acharyas have explained: Mandagni, Vishamagni, Tishnagni, and Samagni. Among them, the remaining 3, Mandagni is also going to cause acid peptic disorders, Tishnagni is obviously going to cause, and Vishamagni also sometimes causes the these disorders. One more thing I want to explain here, as most of the PG scholars and the UG scholars are also listening to this lecture, there is a wrong view in today's students' mind that Amla Pitta is explained by Madhava Nidana and Yoga Ratnaka and the recent authors, that Charaka has not explained it. They simply make a statement that Charaka has not mentioned the Amla Pitta. So if so, that is not a correct statement to make. Okay, Charaka also has explained about the Amla Pitta, and Sushruta has also mentioned. The recent authors have just made it more clear and more interesting. Okay, that is the difference only. So how just I'll give the examples or the references from Charaka Samhita. You in the very first chapter of Charaka Samhita, you get the reference of Amla Pitta, that is from Charaka Sutrasthana first chapter. Panduroge Amla Pittecha Doshe Gulme Tatha Udare Atisare Jware Dahe Vayathocha Visheshataha. That is Amla Pitta. The word has come in the explanation of this shloka. This shloka is from the explanation of Dugdha Varga. So where in Charaka Sutrasthana first chapter, while explaining the qualities of Dugdha also, Charaka has explained Dugdha is good in Amla Pitta. This is the first reference in Charaka Samhita Sutrasthana first chapter only will get. And another example from the in Charaka Sutrasthana 25th chapter, there Viruddha Ahara Janya Rogas, there Acharya explains Kilasa Kushta Grahini Gadam Shotha Amla Pitta Jwara Pinasan. There also we will get the reference of Amla Pitta in Charaka. Like that, I can give you number of examples where Acharyas have explained Amla Pitta as one of the indication or one of the disorder, something like that. In Kamsa Haritaki Prakarana also, in Shota Chikitsa where comes, there also in Kamsa Haritaki Prakarana also, Acharyas have explained one of the indication as Amla Pitta. And in one more, that is reference from Charaka Chikitsasthana Grahini chapter, there also Acharya has explained that Samsrujyamanam Pittena Daham Trishna Mukhamayam. There also you will get the Janayati Amla Pittam cha. When the Prakupita Pitta combines with the Ama, it is going to cause Amla Pitta. That is also one of the reference. And another reference is from Charaka Sutrasthana Agrevshati Gana. There also you will get the reference that Kulatha Amla Pitta Janananam Shreshtaha. That is Kulatha is Shreshta in Amla Pitta Janana. So it is not a, it should not be the notion from the student side that Charaka and Sushruta has not explained the Amla Pitta, or they might not be knowing that Amla Pitta is a disease. It may be recently developed by the recent authors. No, it is not correct. Acharya Sushruta and Acharya Charaka were knowing about this disease. They knowingly they might have not explained it in detail, as there are scattered references are available, and they might be thought that it is going to include in the Grahani Chikitsa only. Why to explain it once more? That may be their understanding. So Acharya Charaka has explained it. So coming to the causative factors of these acid peptic disorders, what are the causes for these acid peptic disorders? There also that reference from Madhava Nidana, there he explains Viruddha Dushtamla Vidahi Pitta Prakopi Pananna Bhojo Vidagdam. So today's world, Viruddha Ahara, everything you see, it is Viruddha Ahara. For example, today we see fruit salad. Who has explained to eat the fruit salad? There is no reference of fruit salad in our Shastras. There will not get the direct reference from Shastra to eat fruit salad, isn't it? Fruit salad is not explained. It is a mixture of more than 2 to 3 fruits. So it becomes Viruddha. Some people take Tugdha with salt. So milk with salt become Viruddha, isn't it? So all these things with fruits, some people eat Dugdha, that is fruits and milk, milkshakes. Nowadays it is very famous, milkshakes. So these all are the causative factors for Amla Pitta. They are directly explained by Acharya Charaka, Sushruta, and in all the Shastras in Ashtanga also. So this should be explained to the today's students that in modern era also these Nidanas hold good. So Amla Pitta is one of the cause which happens due to these Nidanas. So Viruddha Ahara, Dushta Ahara, Amla Rasa, excessive Amla Rasa, that is excessive Amla Rasa, sour taste foods. Okay, that is also one of the causative factor for amla, this acid peptic disorders. Pitta prakopa, panana bhojo vidagda. What is vidagda? Vidagda shabda is explained in Ashtanga Hridaya in the 5th chapter. There they explain that vidagda ahara is one which stays more time during the pittaja in avastapaka. That is in Dvitiya avastapaka, which food stays longer in time. That is called as vidagda ahara, or which causes vidagdata in the jఠra. So pittam swahetu upachitam pura yat tad amla pittam pravadanti santah. So amla pitta is a condition due to which there is viruddha, that is vidagdata is present in the amashaya. So in that you can include the the gastritis or the duodenal ulcers, gastric ulcers, the irritable bowel syndrome. All these things can be included in this concept. And one more very important thing I want to explain here is that Acharya Kashyapa in Kashyapa Samhita has explained very beautiful nidanas for these things. Viruddha Adhyashana Ajirana Amecha Purana. More the continuously eating. The person starts eating from the morning and till he goes to night, he go to bed in the night, he wants something or other thing. So this is also going to cause the ama in the body. So when the ama is formed, it is going to cause vidagdata. When it is getting pitta samsarga, it causes amla pitta. Pishtannanam, excessive pishta ahara. Pishta is maida. Today's maida, that pizzas, burgers, everything, these things. Okay, madhyanam cha sevanat, madhya as alcoholic beverages. So what they are going to do? They are going to cause the amla pitta. No, they are going to cause agni mandya first. They are not the hetus for amla pitta. They are the hetus of agni mandya. When the agni is bandha, it is going to cause several disorders. In Udara Chikitsa Adhyaya, Acharya Charaka beautifully explains that mandagni is the cause for all the disorders. Mandagni causes so many disorders. Okay, so all the disorders can be caused by mandagni. So when this samprapti takes place here, ऐसा कोई संप्राप्ति घटता है जिसकी वजह से ऐसा जो फेवरेबल वातावरण अगर मिलता है पेशेंट को, पेशेंट के शरीर में, तो वो संप्राप्ति घटता है. तो ये जो हेतु है वो दोष प्रकोपक हेतु है, वो व्याधि के हेतु नहीं है. यहाँ पे जो भी हेतुओं का वर्णन आचार्य माधव ने किया हो या आचार्य कश्यप जी करते हैं, वो सभी हेतु व्याधि के कारक हेतु नहीं है, वो दोषों के प्रकोपक हेतु है. अगर वो दोष प्रकोपित हुआ तो वो आम्लपित्त की वजह से वो ग्रहणी भी कर सकता है, वो ग्रहणी की जगह पर कोई अतिसार भी कर सकता है, वो कुछ भी कर सकता है. अगर शरीर में प्रोतो वैगुण्य है, ख वैगुण्य पहले से है, जो ख वैगुण्य चल रहा होगा वो डिसीज शरीर में बन जाएगा. तो ये अगर अंडरस्टैंडिंग डॉक्टर्स के पास है तो ये जो कारण के व्याधि के कारण पता है, उसके हेतु क्या है ये पता है, तो इसकी चिकित्सा करना बहुत ही आसान हो जाएगा. प्राय ऐसे लोगों में अग्नि मंद ही होता है. तो मोस्ट ऑफ द टाइम्स यू सी द पेशेंट्स ऑफ आम्ल पित्त, देयर इज अग्नि मांद्य इन देम. Okay, you may say it is amla pitta, it is so much of burning. Even the burning water can cause the fire to switch off, isn't it? चलते हुए पानी, उबलते हुए पानी भी आग को बुझा सकते हैं. So that is the concept. So तो प्राकृत अवस्था ऑफ जो पित्त है वो कटु रस होता है. So in the vikrita avastha it becomes amla. So when the amla rasa, that is the sore eruptions when the patient is facing, so that is it is the amla pitta, that is the vidagda pitta or the vitiated pitta. So this is how it goes. So in the hetus, if we see the more we concentrate on the causative factors, you can see in Charaka Chikitsa Sana 15th chapter, in Grahani Chikitsa, Acharyas have beautifully explained the hetus. They are abhojanat, ati bhojanat, vishamashanat, asatme gurushita, अतिरूक्ष संदुष्ट भोजनात्, विरेक वमन स्नेह विभ्रमात्, व्याधिकर्षणात्, देश काल ऋतु वैषम्यात्, वेगानां च विदारणात्, दूषति अग्नि. यहाँ पर वो आम्ल पित्त के या ग्रहणी के कारण कारक नहीं है. यहाँ पे आचार्य स्पष्ट लिख रहे हैं ये अग्नि के दूषण करेंगे. तो व्हेन दे डू द अग्नि दूषण स दुष्टो अन्नम न तत्पचति लघ्वपि. ऐसा जो आहार का परिणाम हुआ वो अग्नि को दुष्ट किया, वो अग्नि को दुष्ट करता है, तो वो अग्नि न तत् पचते लघुपि, लघु आहार को भी वो सम्यक तरीके से पचा नहीं पाएगा. तो ऐसे अवस्था में जो लघु को ही नहीं पचा पा रहे वो गुरु को क्या पचा पाएगा. तो जो फूड मटेरियल जो लघु थे उनको भी अग्नि पचाने की सामर्थ्य नहीं रखेगा. So in that condition, अपच्यमानम शुक्तत्वम यात्यन्नम विषरूपतम. So due to that, there is शुक्तत्व आएगा. जो आहार हम खा रहे हैं उसको शुक्तत्व आएगा. तो व्हाट इज शुक्तत्व? चक्रपाणी जी नीचे कमेंट्री में लिखते हैं शुक्तत्वम इति आम्लताम. व्हाट इज शुक्तत्व? इट इज आम्लता. वो आम्ली भवन होगा, वो सड़ जाएगा. In other words, it is getting spoiled. That food material which is present in the amasya, it is getting spoiled and it is becoming visharupatam. It is becoming visharupa. What is visharupata? Visharupata is nothing but विष जैसा बहुविकारकारी होगा. जैसे विष से बहु और व्याधि उत्पन्न हो सकते हैं, ऐसे इस आहार रस से, इस आम से शरीर में बहुत सारे व्याधियों को उत्पन्न हो सकता है. आप देखते होंगे आम्ल पित्त के पेशेंट आता है, उसके पास स्किन के एरप्टेशंस होंगे, स्किन डिसऑर्डर्स होंगे, उसको गैस ट्रबल होगा, उसको एब्डोमिनल डिस्टेंशन होगा, उसको सिर दर्द होगा. So these kinds of disorders you will see in the day-to-day practice. It is due to the दुष्यते अग्निम. अग्नि दुष्ट हुआ है. अब हमें अग्नि की चिकित्सा करना है. उसको सिर दर्द हो रहा है तो शीर्षोलादि वज्र रस, उसको अतिसार हो रहा है तो कुटज घनवटी, ऐसा लिखते बैठेंगे तो नहीं होगा. So that is what the Vaidya should understand. Okay. So Mandagni Vyapat should be understood here. So in Mandagni Lakshana also Acharyas have clearly mentioned in Mandagni conditions, Loha Ama Gandhi, Tiktamla Udgarasya Jayate. The Acharyas have clearly mentioned what are the Lakshanas of Mandagni. When to consider it as a Mandagni, it is directly mentioned that the person feels Loha Ama Gandhi. You experience that. So Loha Gandhi and Amla Gandhi Udgara will be there. The sore eruption, the bad breath, everything is Mandagni Lakshana. So this is how you should understand the concept. So उसके लक्षण क्या क्या होंगे? विष्टंभ होगा, सदन होगा, गौरव होगा, सिर में दर्द होगा, भ्रम होगा, पृष्ठ कटिग्रह होगा, पेन होगा, बैक होगा, कटिशूल होगा, जृंबा होगा, अंगमर्द. All these lakshanas can be included under the amla pitta. So this is how the broad aspect of acid peptic disorders it is. So not only the acidity, it is a very broad aspect of condition. So one more thing is in Kashyapa Samhita, he further explains that manti karoti kayagni mardava magate etane abhi tata bhuyah seva manasya durmate. एक ऐसा शब्द इस्तेमाल किया है आचार्य कश्यप जी ने, durmati. The person is called as durmati. The person who is continuing such hetus or such nidanas, he is called as durmati. His mati is lost. We should not do such nidanas. That is, the patient has not read the Kashyapa Samhita, so it is our duty to explain him that whatever you are doing is wrong thing. Okay. So what are the practical nidanas? So is all Shastra nidanas we have read. What are the practically today we are seeing? So as I explained, there are so many conditions when the patient comes to you with this acidity. They are continuously taking the sprouts, okay, the proteins, and they are continuously eating tomatoes. They are eating maida, pizza, burgers, okay, madhya, excessive alcoholic, pickles, continuous intake of pickles, fast foods nowadays, chats, isn't it? Drugs like aspirin, so continuous taking of aspirin, paracetamol, NSAIDs, on counter sale of these antacids. So this all have worsened the conditions. So rice also, today's we are eating the polished rices. So that polish over the rice, that is also going to cause Shuktatva. And some people used to pour boric acid on the food grains to make them survive for long days. So these all are the today's the hetus or the today's reasons for these acid peptic disorders. Acharya Charaka, he scolds the person who does like that. यो हि वित्ते विधिम त्यक्त्वा ग्रहणी दोषजन गदन स लौल्यात लभते शीघ्रम वक्षन्ते परम तुते. दैट इज लौल्य है. ऐसे पेशेंट्स में लौल्य बटन, दैट इज एक्सेसिव wish of consuming something. ये मुझे पसंद है तो continuously खाते जाना. So all these things cause these disorders. So in these conditions, अन्नद्रव शूला, परिणाम शूला, कफ पित्तात्मक शूला, all these things come. So gastric ulcers can be compared with the अन्नद्रव शूला, and duodenal ulcers परिणाम शूल से हम कंपेयर कर सकते हैं. गैस्ट्राइटिस वो कफ पित्तात्मक शूल है, कफ भी है उसमें, पित्त भी है. कफ स्थान है, पित्त का एसोसिएशन हुआ है. आमाशय कफ का स्थान है, उधर व्याधि पित्त का हुआ है, तो कफ और पित्त की चिकित्सा हमें करना पड़ेगा. So when Krimi association is there, you might have seen so many patients of H pylori nowadays. तो endoscopy करेंगे तो सैंपल से पता चलेगा H pylori है. तो these all things are, कृमि क्यों पैदा होंगे? हमने एक एनवायरनमेंट ऐसे बनाया हमारे आमाशय में, तो वहां पर कृमि भी उत्पन्न होने लगेंगे. So this is about the just now what I have spoken, that is शुक्तत्व to the food material, that is it is going to spoil, वो सड़ रहा है अंदर से. तो हमें आमाशय की शुद्धि यहाँ पर करना होगा. तो लक्षण के बारे में हमने बताया. उसके बाद हम जाएंगे एसोसिएटेड कंटेम्प्ट्स में. सो स्किन एरप्टेशंस मैंने बताया, बैकएक होगा तो रेफर्ड पेन होगा, तो कटिशूल, छर्दी. और one more very important thing I want to concentrate here, that is the on counter sale of these antacid. Nowadays omeprazole, pantoprazole, ranitidine, these all things किराने के शॉप में भी मिल रहे हैं छोटे छोटे गाँव में. So what happens due to continuous intake of these things, थोड़ा भी बर्निंग होने लगा, थोड़ा भी गैस ट्रबल ऐसा लगा उस पेशेंट को, जाएंगे ranitidine खा लेंगे. तो इससे क्या होगा, there is a threat of continuous वो HCl जो ब्लॉक हो जाएगा. उसके वजह से हमारे आयुर्वेद शास्त्र से हम अगर देखते हैं तो एक थोड़ा भी नोजिया होने लगा, even if the very light nauseating feeling also the person takes, तो वो छर्दी का वेग है. So when we suppress the छर्दी vega, that is also one of the aparadha we are doing, that is छर्दी vega dharana we are doing. So छर्दी vega dharana, why it is considered? Because he is taking the antacid and he is suppressing it. The vikrita doshas are trying to come out. Due to that there is nauseating feeling and there is the klama, udgara, all these are happening, and we are giving antacid and suppressing it. तो दोष जो बाहर निकलने चाहेंगे वहीं रहेंगे. तो एक छर्दी का वेग आ रहा था, उसको हम दबा दिया. तो ऐसे छर्दी का वेग धारण करके 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 आगे जाके वो एक व्याधि भी उत्पन्न कर सकता है. तो ये सब पेशेंट्स को हमें एजुकेट करना पड़ेगा. इसके बाद पित्तज ग्रहणी जो है वो आम्ल पित्त के लक्षण दोनों समान दिखाई देते हैं, तो पित्तज ग्रहणी की चिकित्सा हम यहाँ पर कर सकते हैं. तो अगर हम और एक वेरी इंपॉर्टेंट going deep into the amla pitta or the acid peptic disorders, how to understand the dosha anubandha in that. So how you understand that the amla pitta is with which dosha? Obviously there is pitta, in the word itself it is amla pitta. So still that even then there is the doctor should understand, that is amla pitta is vataja in nature. Amla pitta is associated with the pitta, or whether the amla pitta is associated with kapha. That is also very important. Very keen observation when we do, we can see that when there is amla pitta is associated with vata dosha, it causes pain, isn't it? So shula adi lakshan dikhai denge. There is a shula in the chest region. The referred pain is felt on the back region, and there sometimes the patient feels radiating pain in the hands, isn't it? It mimics the like pectoralis major and all. There also will be in the pain. So these all are vata associated. What is pitta? When there is pitta associated, you will feel severe burning in nature, and daha, osha, chosha, raga, all these lakshanas are things. When it is associated with kapha, it will be gaurava, udgara, sorry for the inconvenience. When it is kapha associated, the person feels udgara, that is heaviness in the chest, nauseating feeling, and watering in the mouth. So all these things are seen. So what is the meaning? Why we should understand this vata pitta kapha even in the amla pitta in a clear cut case of pitta is, when there is shula, we have to give pitta shamaka, also vata shamaka aushadhi. When there is kapha associated with amla pitta, we need to give some pipana along with that pitta shamana, isn't it? When there is shuddha pitta, it is only necessary to do pitta shamaka chikitsa. So going to चिकित्सा aspect, अभी व्याधि के बारे में बहुत हमने देखा. So अभी चिकित्सा के बारे में अगर हम देखते हैं तो first and foremost thing a वैद्य should do is pitta shamana chikitsa should be kept aside. Then he should go to the anaparivarjana chikitsa. What are the हेतु, किस हेतु की वजह से ये आम्ल पित्त हुआ है? अभी एक एग्जांपल मैं देना चाहता हूँ. एक पेशेंट रिसेंटली मेरे पास आया था, तो उस अवस्था में severe burning sensation, and he used to pass more than 4 to 5 motions in the daytime, 4 से 5 बार, and severe heaviness, severe shirashula, and constipated sometimes, समटाइम्स लूज मोशंस, तो विषमाग्नि था। तो ऐसे लक्षण के साथ पेशेंट आया था। तो पहले तो सभी बहुत सारे डॉक्टर्स के पास वो एंटासिड वगैरह, इवन आयुर्वेदा डॉक्टर्स आर ट्रीटेड, but this was a case of challenge because he since 3 to 4 months 4 years he was suffering. So in that condition, without knowing the hetus why it is not getting relieved, we should not proceed in the future. Again it will be in ruin, isn't it? So when I inquired him what are all the things, what all the routine things he is doing in his daytime, in his lifestyle, what are from the beginning, सुबह कितने बजे उठता है, वहां से लेके हमें प्रश्न पूछने पड़ेंगे। तो पेशेंट अगर सुबह बहुत देर तक सो के उठ रहा है, 9 बजे 9:30 बजे उठता है, तो इट इज अ क्लियर कट केस ऑफ दिबा स्वप्न, इजंट इट? सो दिन में अगर सोना, तो दिन में सोना मतलब सिर्फ दोपहर को सोना नहीं है, दिन शुरू होता है सूर्योदय से, सूर्योदय के बाद भी अगर सोता है तो वो दिबा स्वप्न ही है। तो ऐसे कफ का हेतु था। उसके बाद वो दूध पीता था सुबह, एसिडिटी ना हो इसलिए। उसके बाद बहुत सारा पानी भी पीता था सुबह। उसके बाद वो ड्राई फ्रूट्स खाता था और विरुड़ धान्य दैट इज द स्प्राउट्स खाता था। ऐसे बहुत सारे चीज वो कंटिन्यूसली करते रहता था। ऐसे करते करते वो फुल दिन भर कुछ ना कुछ ऐसे हेल्दी है इसलिए कोई बोला है, इसलिए ही विल बी कंटिन्यूसली ही वाज ईटिंग। So all these things has led to Agni Mandya, thereby causing these symptoms of acidity, these all things. So first and foremost thing I done was to stop all these hetus. First, I explained him everything that what and all he has to do. So all these things with chart when we explain him, and just I have given some Musta Churna and Prikatu Churna to him, nothing else, simple remedies. So with that, he after 8 days he was it was some Deepana Pachana and also Grahi action, and his symptoms were relieved more than 50%. Where what we have done there is just simple Nidana Parivarjana Chikitsa. तो निदान परिवर्जन ही चिकित्सा है, संक्षेपतः क्रिया योगो निदान परिवर्जन। तो निदान का अगर वर्जन करेगा पेशेंट तो व्याधि का आगे जाने का संभावना बहुत कम हो जाए। तो इन ऑल द रोगा निदान परिवर्जन इज वेरी इंपॉर्टेंट। So this is a simple case, what I was explaining. So they, like that, so many cases every day, as there are so many senior Vaidyas, they will see. So because of the hetu, what are the, without asking the hetus, why this disorder has come, it is very difficult to treat any patient. So हेतु क्या है? वो नवीन शाली से हो सकता है, वो अभिसंधि से गुण होने की वजह से, and some people have a habit of hot water and honey and lemon into it. So all these things are hetus, they are not explained in our shastras. So these all are going to cause the disorders. And then what is the chikitsa? So chikitsa aspect, when we divide the chikitsa into shodhana and shamana, ऐसे severe conditions है, 7-8 महीने से ऐसा problem है, since more than 2 to 3 years the patient is suffering, then there is no use of giving again the shamana chikitsa. So as the vyadhi is very deep rooted and it has gone into the dhatugata avastha, then we have to go for the shodhana chikitsa there. What are the shodhana chikitsas explained is like acharyas have explained it clear cut in the Yoga Ratnakara. There is a direct reference of Amla Pitta Chikitsa. There he has explained पूर्वं तो वमनं कार्यं पश्चात् मृदु विरेचनम कृतवांत विरिक्तस्य सुस्निग्धस्य अनुवासनं। दैट इज पहले हमें वमन करना है, उसके बाद विरेचन करना है, उसके बाद सुस्निग्ध होने के बाद हम उसको सुस्निग्ध होने के लिए अनुवासन देंगे। तो शोधन का इंपॉर्टेंट क्या है? तो इसके लिए अगर हम देखेंगे तो कश्यप संहिता चिकित्सा स्थान, देयर ही एक्सप्लेन दैट इन खिलस्थान, सॉरी, so in Kashyapa Samhita is explained some very beautiful shloka about the Amla Pitta. He explained, अविशुष्के यथा क्षीरं प्रक्षिप्तं दधिभाजने क्षिप्रमेव आम्लतामेति कूर्चि भावं चलति. That is, a pot of dadhi is there with us, and we have not properly cleaned it, and simply we poured the dahi outside and we have filled the milk into it. What happened? That milk also will get spoiled. Similar thing is happening into the patient's body. There is severe amlata is present and vidagdhata is present is in amashaya. Without proper cleaning into it, and we are whatever we are adding, we are adding also it is getting spoiled. So that is how the chikitsa should be there. So we should give him vamana or the virechana based on the condition of patient. Again, the patient should be vamanarha, vamanarhasya deyam, not everyone. Okay, and If you cannot do the Vamana, then go for the Virechana Chikitsa is also helpful here. So आमाशयोक्त व्याधि है इसलिए वमन अच्छा रहेगा, as the मूल स्थाना is kapha and the व्याधि is pitta, so hence Vamana will be very good. Then going to the विरेचन चिकित्सा, तो पित्त प्रधान अवस्था है, तो पित्त के अधोगत आम्ल पित्त का भी अवस्था है, तो मृदु विरेचन इज वेरी ब्यूटीफुल हियर. So क्यों मृदु विरेचना? It means the अर्थापत्ति is that you should not give तीक्ष्ण विरेचना in these conditions. So दोष संसर्ग अगर है तो उसको हिसाब से हमें चिकित्सा करना पड़ेगा. तो विरेचन और वमन के लिए हमें the selection of drugs, which drugs we have to select. In that there are so many ghritas, kalpanas have been explained, that is like Mahatiktaka Ghrita, Dadimadi Ghrita, Vidaryadi Ghrita, Tiktaka Ghrita, isn't it? So all these ghritas you can select. So based on the condition of the patient. So if it is Vata associated condition, Vidaryadi Ghrita, as it is Brahmana also, and also Vata Shamana, along with that Pitta is also taken care. And Dadimadi Ghrita, Indukanta Ghrita, when we along with. So all these things the doctor in mind. And for Virechana, you can do Trivrit Avaleha. It is not every time necessary to do the Samyak Snehana and then go to Virechana. Even the conventional way is also can be done, as it is not possible every time to do the classical types. So Anatisnigdha also is okay. Then Virechana, you can give it Trivrit Leha or Aragvadadi, and Sneha Virechana can be given with Erenda Sneha or something. Even Avipatti Churna can also be used. Avipatti Churna is very beautiful in these conditions. It is explained Prayasha Pitta Rogina. Avipatti Churna is not Avipatti Kara Churna here. Avipatti Churna is different and Avipatti Kara Churna is different. The one who is not knowing, I am telling to them. That is Avipatti Kara is Shamana Yoga and Avipatti Churna is the Shodhana Yoga. It's explained clearly in the Ashtanga Hridaya. Avipatti Churna containing more amount of Privrit and Sharkara in nature, so which is a Shodhana Yoga. So it is, can be used for the Virechana. You can take 25 grams of Avipatti Churna and mix with the hot water, and 1 teaspoon of honey can be given to the patient to for the Virechana. You can appreciate more than 10 Vegas in that. So this is the thing. Practically, we have given more than 100 to 150 Virechanas with Avipatti Churna, and there is no such complication I have seen. So Vipatti, as the name itself indicates, Avipatti, there is no Vipatti when we give Avipatti Churna. So this is how the Virechana can be performed. Then Basti selection is very important. When to do Basti is again when the Jeerna Avastha, there is a patient is very much emaciated and he cannot tolerate all such treatment. Then you can give Anuvasana or even the Tikta Kshira Basti or the Kshira Basti Chikitsa, and the Narikela Jala Basti is also appreciated in this. Narikela Jala is given into as the Basti. So coming to this is about the Shodhana Chikitsa, as the Dadi Bhajana explained, that is the pot of dahi, the whatever the simile we have given. After cleaning everything, after the post is Shuddha and Agni is Deepta, then we can go for the Shamana Chikitsa in all these acid peptic disorders. Okay. So in Shamana, if the patient is acute and there is no, as you if you see, there is no much need of Shodhana here, you can give the Shamana Chikitsa. So in Shamana, one should keep in mind that in these acid peptic disorders, you have to do Deepana also, you have to do Pachana also. When we give Katurasa Ahara or the Katurasa Aushadas and Amla Rasa, so even though they are best Deepana in nature, but we cannot give in Amla Pitta conditions. So Katurasa and Amla Pitta. Then what is the choice? For we have to do Deepana also and Pachana also there. So we have left with the Tikta Rasa Dravyas. So Tikta Rasa is very beautiful, and Tikta Rasa can be advised to the patient the conditions of Amla Pitta, which does both Deepana and Pachana. Also the Shamana of the Amla Pitta can take place. And drugs like for Tikta Rasa कौन से दे सकते हैं हम? कटुरोहिणी है, पटोल है, सर्ज क्षार है, कटुकी है. So all these are Tikta Rasa and also Amla Pitta Hara and acid peptic disorders में हम दे सकते हैं. पित्त हरा और पित्त रसा. पित्त रसा होने की वजह से पित्त हर होते हैं. So even the patola is a very beautiful drug here, which does both the Deepana and also the Pitta Anulomana here. So even the ZANDU company has a formulation called Zenacid, So Siddhio, which contains Yashtimadu extract and Shukti and Shanka, all these mineral products also. So Shanka, Shukti, Kapardaka, Pravala, Mukta Basma, all these things can also act as rust acid neutralizers, and amlata will be reduced. And coming to the Patoladi Kashaya, as the Kashaya practices in the south region, so Patoladi Kashaya, Patola, Amrita, Prapataka, Nimba, and Bhunimba, and Triphala are the contents. So all these things are Kaphahara and also Pittahara, and at the same time there is a soothing effect can be given to the Amashaya. Even if there are some ulcers also, it will heal. That is the Patola Dikashaya is very beautiful combination in these conditions. And coming to the Bhunimba Dikashaya, Bhunimba is again Pittahara and also Pittarechana and in very Shita Virya. So Bhunimbadi Kashaya can also act very well in these conditions. Coming to the Shatavari, again, the Shatavari is also a Madhurarasa Shita Virya Dravya can be given. And coming to the very famous prescription of all the Ayurveda doctors, that is Avipattikara Churna. Avipattikara Churna contains Trikatu, Triphala, Musta, Vidam, Chavi, Vidangakam, that is explained. And the main important thing here is Lavanga, which is 11 parts in Avipattikara Churna. So 11 parts of Lavanga is explained, and Trivrit is 44 parts, and Sita is 66 parts. Okay, you see the combination. Lavanga 11 parts, Trivrit 44 parts, and Sita is 66 parts. So the ratio becomes 1:4:6. So why Lavanga? Why Lavanga is explained in Avipattikara Churna, which is very Ushna again, why it may cause acidity, right? So the similar question came into my mind when I did some small research about that in Samhitas and Nigantus. I found that Lavanga, even though it is Katurasa in nature, it is very Katurasa in nature, it is not going to cause Pitta Prakopa. It is a Shita Virya Dravya. Okay, in Nigantus, there is a reference of Lavanga. Hence, the Acharyas have put it in Avipattikara Churna. And being Trivrit 44 parts, it is going to cause Karana of dosha, and Sita is again 66 part. It may compensate the Katurasa of this Lavanga also. So Trikatu is also present, Triphala is present, Musta is present, Vidanga is also present. So Vidanga again the best Krimigna Dravya. It is going to cause, if any krimis are present in Amashaya, it is going to cure it. So this is about the Avipattikara Churna. Then coming to the Drakshadi Kashaya, it is very beautiful yoga, that is Drakshadi Kashaya. It is very soothing in nature. Draksha is again, it is Brahmana and also Pittahara, Pitta Saraka in nature. So Drakshadi Kashaya can be given to the patients of Amla Pitta in acute conditions, in severe pain, burning sensation. It is very beautifully, it is going to act. And even you can try with the Drakshadi Avaleha also. In after the Shodhana, and you want to do Brahmana also and Amla Pitta care also you want to take, then go for the Drakshadi Avaleha. Then some patients come to you with the severe anemia, and also there is Amla Pitta. It is very like Dharma Sankata to a doctor, like we cannot prescribe the Loha preparations there as it triggers Amla Pitta, and we cannot leave also because we need to improve the hemoglobin, and Panduta also should be taken care. In such conditions, the Dhatri Loha, the tablet Dhatri Loha can act very well, as Dhatri is present Amalaki, which is not going to raise, let the Pitta raise, and Loha is present in the combination. So again, one more very interesting yoga is Swadishta Virechana Churna. That is, can be kept in the night time for several long period also, through the Anulomana of doshas. And coming to the Rasoshadis, what are the very useful Rasoshadis in these acid peptic disorders are Sutta Shekara Rasa. When to give Sutta Shekara Rasa and when to give Kamaduga Rasa is a controversy, isn't it? So Sutta Shekara Rasa and Kamaduga Rasa, I will give a hint, and it is left to you to practice. Sutta Shekara Rasa is very beautiful in Kama condition of Pitta, whereas Kamaduga Rasa is very beautiful in Nirama Avastha of Pitta. So what is Sama Avastha of Pitta and Nirama Avastha of Pitta? You have to read about it, and it takes very long time if I go into that. So Narikela Lavana is also very beautiful combination. Narikela Lavana, if you want to know more about Narikela Lavana, there is a video on YouTube. I have made a video that also you can go, and Sanatana Ayurveda page is also there. In that Narikela Lavana I have prepared and explained the step-by-step stages how to make this Narikela Lavana, and its use. It's a very beautiful yoga in Amla Pitta Adhikara, and especially it is explaining Parinama Shula, where there is severe pain. In that condition, Narikela Lavana works wonderfully. So as it is Lavana Kalpana, the penetration is very good, and Soto Shodhana action is very good. So Narikela Khanda is also very interesting yoga. Khanda is prepared with Narikela and Sharkara, and it is very tasty to eat also, and also at the same time it cures the Amla Pitta. So Vaishwanara Churna, what is the role of Vaishwanara Churna in Amla Pitta? It is a Deepana Yoga. Even though it is a Deepana Yoga, Haritaki is present in more amount. So it is going to do the Anulomana of the doshas. I give usually a Vaishwanara Churna with Narikela, equal quantity when I mix, and give the patient to take it before food. It is going to work very wonderfully. Even the Deepana also takes place, and Pachana also takes place, and Anulomana is also going to cause. And when there is severe pain, severe condition, then I mix Godanti Basma also along with Vaishwanara Churna and Narikela. So again, one more combination of Bhunimbadi Kashaya and Draksha Godanti Basma Avipatikara Churna combination. Along with that, Bhunimbadi Kashaya, and this takes a prolonged treatment of more than 1.5 months. So this is Shodhana is also sometimes necessary in those conditions. So when there is Krimi association, you can add Krimi Kuthara or Vidanga as one of the ingredient along with these conditions. So this is about the Amla Pitta Chikitsa, and finally I want to conclude with the quotation in the Charaka Grahani Chikitsa that when there is proper Agni is maintained in the body, that is as it is explained, Sarvamanyam Parityajam Shariram Anupalayat. Similarly, Sada Tasmat Agnim Sada Rakshet Yatnataha. Yatnataha we should do the Rakshana of Agni, then only it is going to give you the best health. With this much explanation, I want to conclude. If any doubts are there, they are welcome. Thank you, sir. Thank you for such an opportunity.
Excellent.
Thank you very much. So now I would like to present just 2 slides with information. So this is about today's webinar series. So the topic already, it's a well executed and it's very impressive session with Dr. Vidyasagar M. Panchal. So we from ZANDU, we have some products which are very much related to this acid peptic disorders, like from ethical portfolio, we have a product called Genocidio. So it's a dual herb combination Genocidio. It's very unique combination of gut guard. That gut guard is a patented word. We patented this gut guard to the licorice extract, that is St. Madhu. And one more ingredient in this Genocidio is Mukta Shukti Basma, that is everybody knows that natural calcium carbonate, what we call. So first time in the Ayurveda, we made a bi-layered tablets, double layered single tablet. So 2 ingredients, 2 layers, green color and white combination you may see on the strip mentioned on the image. So green is an St. Madhu, that is a licorice extracts, and we call it as a gut guard, and white portion is Mukta Shukti Basma. So gut guard offers, it is a long-term gastroprotection by enhancing the mucin secretion and also it extends the lifespan of mucosal cells. And where Mukta Shakti is concerned, Mukta Shakti present in this Genocidio will neutralizes the excessive acid and the neutralizing value is more than the recommended standard from the API. So this is our Genocidio tablet. There's a tablet from 10 tablets, 1 strip, and one more we have Pancharishta DR. In the property as a proprietary medicines we have in OTC division, we have Pancharishta plain. So this is Pancharishta DR. So it's a unique combination of all 5 Arishta and Asava base. So the Kumari Asava, we have an Ashwagandha Rishta, Dashmula Rishta, Traksha Rishta, and Loha Asava. It is not the mixture of these Asavas or Arishtas. We derived the, we have taken an ingredients present in the Kumari Asava and the ingredients in all the Aloha Asava ingredients from ashwagandha rishta and ingredients from the dashmula rishta, then ingredients from the draksha rishta, and we combined a unique product, and we added additionally we added an sova seeds in this, which regulates the digestion. So that's why we kept the Pancharishta DR. That means the Pancharishta for digestion regulator. So it is used as a digestion regulator. 450 ml of glass bottle we still maintain. So apart from this, we have some other brands also related to the digestive health. That is, we have generic portfolio, that is classical medicines also, like Agnitundi Vati, Chitrakani Vati, then Himesh Churna, then for property medicines we have Alpitone and Zandu Fort also. Then for whereas acidity, gastritis and or ulcer is concerned, we have Avipattikar Churna, Kamududa Rasa, then we have Kamududa Rasa both Sada and Shankha Bhasma, Sudshekar Rasa, what sir is discussed now, Dadimastak Churna, Yashti Madhu Churna and Janasidio, of course we already discussed. And whereas for digestive health, there are dysentery and diarrhea is concerned, we have classical products like Bilwadi Churna, Sanjeevini Guti, then Kutaja Ghanavati, then Kutaja Rishta also. Whereas nausea and vomiting is concerned, we have special product like Madhifal Rasayana and Drakshadi Churna. As for the liver health, we have Arogya Vardhini Vati, Kutaja Rishta, Kumari Asavan, Livotrit, Fort, tablet form as well as liquid. And where a digestive system, whereas constipation and piles or anorectal disorders is concerned, we have some product like Abhyati Modak, then Harde Churna. We have tablet form also, then Swadist Viration Churna, Tripala tablet, Suran Vata, Kanika and Guti and Abhyarishta. So, and particularly for the indigestion and flatulence, we have Bhaskar Lavan Churna, Hingvastak Churna and Chandujam Fort. So these are all some important product portfolio related to the digestive system. And with this, I request all the doctors, participant doctors, please that use these products. So thank you very much for listening patiently. And now over to Dr. Pawan Kumar Sharma. Thanks.
Very nice presentation. Very nice presentation. Excellent speech.
Thank you, sir. Thank you.
Indicates the greater knowledge of the doctor, Ayurvedic expert. I am really proud to have you on my platform. Thank you. Thank you very much. Thank you very much.
It's a great privilege to listen such words from such an eminent person like you, sir.
Thank you. We will be meeting again, doctor. We will be meeting again. Don't
Thank
worry. All the best. All the best.
Thank you, sir.
Dr. Sadanand. Dr. Sadanand,
Yes, sir.
please conclude the session.
Yes, sir. Listen. Yeah.
Okay.
Thank you.
Session we have participant experts, Chandan Imami, we'll heartily pay a thanks to get. We are very grateful to you, and we pay you. And would like to thank all the experts and doctors from my heart, and special team and special. Thanks and thank you.